Well, hello, everyone. Thank you for being here. My name is Arthur Stamoulis. I am the Executive Director of the Trade Justice Education Fund, one of hundreds of organizations working to remove the World Trade Organization's barriers to COVID vaccine test and treatment access. And I'm very sorry to report that as the WTO heads into its ministerial conference this Sunday, its biggest meeting since the start of the pandemic, it is negotiating off a text that not only completely fails to remove existing intellectual property barriers to vaccine test and treatment access, but that would actually impose some new barriers as well. The WTO's current stance, led by affluent nations, including the United States, backed by big pharma, is a recipe for more death, for more suffering, and for new COVID variants too. And so to discuss these issues, we have an excellent panel of experts from leading public health, development, and human rights organizations. And to introduce them and to introduce the situation at the WTO more broadly, I'm going to now turn things over to our moderator, Lori Wallach, the director of the ReThink Trade Program at the American Economic Liberties Project. Lori?
Arthur, thank you very much, and good morning to everybody. I am going to be introducing 5 fantastic speakers representing some of the United States' most prominent health and human rights and consumer organizations. I want to just set the context for a second before we hear our speakers by saying it is important to understand the reality that we face today, that despite the worst health crisis in a generation, 15 million dead, millions more livelihoods destroyed, there will be no WTO outcome at this ministerial that gets the WTO's intellectual property barriers out of the way for more production globally of COVID-19 vaccines, treatments, or tests that could have saved millions of lives and that are necessary going forward to stop the mass outbreaks that can generate more deadly, virulent new variants that would burst the myth of COVID waning and that will destroy millions of more livelihoods. As the speakers in this news conference will describe, the WTO Ministerial will start this Sunday facing 2 choices, shamefully, between a bad text that could make things worse and no outcome at all. That is what the WTO Ministerial has on offer means it is a failure with respect to the COVID crisis before it even starts. And more broadly, it underscores how the WTO is 100% unfit to mission. To line up the situation, for almost 2 years, South Africa and India have been leading an effort to use the existing mechanism in the WTO to waive the IP barriers. 65 countries co-sponsored it. Another 100 countries support a waiver of some sort. Historically, the Biden administration reversed longtime US opposition, at least in support of a waiver. Only 3 WTO members are against: the EU, UK, and Switzerland. And yet today, there were no negotiations for almost 2 years until the WTO staff offered a rump text no one supports but the EU, the blocking country. That's why civil society groups in Africa, in Asia, and Latin America are calling on their governments to reject the rump text and that we need to have a waiver of these obstacles. So now to hear more about what will happen at the ministerial, the situation, and what could come next, it's my honor to introduce the 5 speakers, starting with Abby Makman. She is the president and CEO of Oxfam America. Abby, please.
Thank you, Lori. We want to be done with COVID, but COVID is not done with us. Despite the unprecedented pace of the development of COVID vaccines and treatments, we continue to struggle with vaccine inequity, new variants, continued suffering, and death. In fact, more than a year after vaccines were introduced, only 14% of people in low-income countries are fully vaccinated, compared with 75% of those in high-income countries. People in low and middle-income countries have been left waiting months longer than rich countries for vaccines, and once supplies began, they were sporadic and too often delivered too close to their expiration dates. As you noted, in October 2020, India and South Africa tabled a WTO proposal that would temporarily waive intellectual property rights to allow low and middle income countries to produce their own generic COVID-19 vaccines, tests, and treatments. And we cheered when President Biden joined leaders from 100 other countries backing the proposal for vaccines. But as Lori noted, there has been little progress since. The US has apparently not been leading the negotiations, and the UK, Switzerland, and the EU have actually blocked progress. And worse yet, countries are now asked to consider a dangerous and limited proposal, which is not a waiver, could add more hurdles preventing poorer countries from producing vaccines, does not include tests or treatments, and is not global enough in scope. And without a waiver, the hoarding of vaccines by rich countries is likely to be repeated with the next generation of vaccines and treatments. In the 20 months since the WTO talks on the IP waiver started, nearly 30,000 people have died of COVID each day. And with each day that continues to pass, there is more death and more suffering that is preventable. And the deadlock at the WTO undermines the credibility of the organization, especially with a looming global recession and rising food and fuel prices. The donation model is not working. Voluntary measures from companies have delivered wild profits, but fail to address persistent vaccine inequity, new waves and new variants, unreliable and insufficient donations. Billions of people are still waiting for their tests, treatments, and vaccines. In the face of this pandemic and others that may come, we need a different model. And it's time for the US to step up and deliver on the commitment to back the actual TRIPS waiver, one that could help ensure more equitable, sustainable supply and access to COVID-19 vaccines, treatments, and tests for all. It is time to put people before profits.
Thank you very much, Abby Makman. And just to underscore, Oxfam is part of the People's Vaccine Alliance, one of the founding groups that many of our organizations are part of, that has been running this huge campaign, and no one's going away. This is not something that we have any alternative to do but resolve. And with that, may I please introduce Paul O'Brien, who is the executive director of Amnesty International America, another of the key partner groups that's been fighting for a real waiver at the WTO and for access to COVID medicines. Paul.
Thanks, Lori. And proud to be working with Oxfam and be a part of the People's Alliance. Associate myself with all of Abby's remarks. Would like to add a little bit of a human rights perspective, although much of what she spoke about was at the heart of human rights work. You know, the health story in this pandemic has been one of unfettered corporate power in the pharma sector, determining who around the world gets this vaccine and who doesn't. When the US initially signaled its support for a TRIPS waiver, we in the human rights community and many civil society groups gave it a lot of kudos for recognizing that we couldn't just leave the indemnification lawyers in these pharma companies in charge. But then the United States, as Laurie said, did not put the muscle into getting an agreement in place over the last year. And now we are where we are, going into this suboptimal moment on the weekend. And that's an understatement if ever there was one. We have the opportunity through this multilateral process to regulate the power of pharmaceutical corporations. And this agreement is not the way to do it. With the way that variants rise, as death tolls increase, as economies are left in tatters, time is not our friend. We are losing people. We are losing economic stability in a lot of countries that have been devastated by the pandemic. Conflicts are rising. Authoritarian populists are using these crises to grow their power. So as a human rights organization, we're seeing the consequences of the failure to regulate this corporate power across the human rights spectrum. A year ago, when we celebrated the US initial commitment to addressing this, the challenge wasn't entirely then, but it was more about getting enough vaccines manufactured so that the North didn't hoover them all up with more and more boosters. But because we failed to act in that moment, that's no longer the challenge. Time has not been our friend. So today's problem, what's being proposed in this agreement, risks being far too little and definitely too late. And let me get specific about that. Because the agreement applies mainly to vaccines, not to medicines and diagnostic treatments being available immediately, it's too little too late. Because it doesn't address barriers to technology transfer, that will actually allow these countries to manufacture adequate vaccines, it's too little too late. Because the waivers restriction applies, as Abby said, only to certain countries, for those eligible countries, and it would leave out so many countries who are far behind in vaccination efforts and make more drastically affected groups within those countries disproportionately impacted by the pandemic. Too little, too late. And then finally, because the proposal includes requirements that go beyond what is required by the current TRIP agreement, it makes it very difficult for any compulsory licenses to be issued and used to produce these vaccines. So those are just some of the problems with this, leaving us with this moment where the US administration, the Biden administration, needs to provide the right signal to the global community, particularly because of the disproportionate power of US pharma corporations in this equation. When President Biden became president, he didn't say he was going to put pharmaceutical profits at the center of his foreign policy. He said he was going to put human rights at the center of his foreign policy. What that means now is recognizing that this agreement is too little too late and continuing to do the negotiations until he has a truly human rights-based set of agreements that provides equal access to all COVID-19 health products for everybody who needs it so we can bring this pandemic to an end. So that's what we're calling for now. Thank you, Laurie.
Thank you very much, Paul. And to underscore the situation at the WTO, at this point, the WTO staff text, because it's a staff text, is putting the reputation of the WTO and saving that ahead of saving lives, as Paul has just made clear. It is now my pleasure to introduce Asia Russell. She is the Executive Director of HealthGap. Asia.
Thank you, Laurie, and it's a pleasure to join everyone today. Although this is very much where we don't want to be. I think, first of all, as the Executive Director of HealthGap, an AIDS activist organization working with civil society groups across East and Southern African countries that have been devastated since the start of this pandemic, it's important to emphasize that the more than 15 million preventable deaths from the direct and indirect effects of COVID treatment and vaccine apartheid, that mass death and disabling event, that was completely preventable. And that's why 2 years ago, almost, when Ambassador Tai announced that extraordinary times call for extraordinary measures, we could not have agreed more. But instead of extraordinary measures at the WTO, what we see today is an untenable, an unacceptable text put forward by WTO leaders and endorsed by a minority of its most powerful members. And we're calling on the majority of WTO member states to do what's necessary, what's difficult but necessary, which is to say enough is enough and to walk away. Because truly, in an unprecedented pandemic, no deal is much better, infinitely better than a bad deal. The stakes could not be higher for the majority of the world's population who endorse a true waiver of intellectual property rights agreement, intellectual property rights provisions put forth by the WTO. The stakes could not be higher, and we need them to lead in the absence of leadership from the Biden administration, from European members, from the UK, and from the WTO itself, who appear more interested in a cynical game of spin and, frankly, a plea for its own relevance, rather than the very real life and death stakes that communities across sub-Saharan Africa and across the global South have been facing. Journalists might be aware that new data just released by the British Medical Journal actually show that developing countries over the last 2 years have actually faced a greater likelihood of death, preventable death from COVID-19 at a rate of 2 to 3 times their counterparts in wealthier nations. The stakes could not be higher. That's why it's so important that countries walk away from this poison pill of a text. It's nothing more than that. And instead, that we focus on what's truly needed. Bilateral efforts, if necessary, to ensure that treatments, vaccines, almost all of which were brought to market with deep corporate welfare funded by US taxpayers, are actually brought into the medicine chests of the global South as urgently as possible, since the WTO clearly is disinterested in actually prioritizing the interests and the needs of communities at greatest risk of preventable suffering and death. And as I close, I think it's important to remember that this kind of impasse not only was preventable, but has actually, in similar circumstances, not been the outcome. More than 20 years ago, I participated in a WTO ministerial in Doha, Qatar, where, because of international outcry over deadly inequities in access to AIDS treatment in sub-Saharan Africa, the Bush administration's trade negotiators, over the petulant objections of Big Pharma, actually put public health first, not because they wanted to, but because they were forced to see the light by feeling the heat. And that resulted in a historic agreement, the Doha Declaration on TRIPS and Public Health. And I think today we're in an improbable and baffling situation where President Biden, who was elected to lead during a time of crisis, is actually stumbling and is prioritizing the corporate interests of Big Pharma over the human need of people in the US and around the world who, quite simply, as Abby has stated, want to be over with COVID, want to feel safe, want to return to economic security, and want to return to a hope to fight for economic security if they never had it to begin with. And unfortunately, the WTO, President Biden, and other minority high-income countries are standing in the way of what should be a very reasonable outcome at the WTO Ministerial Conference. So the world is watching. We hope that developing countries will once again lead and will step away from this poison pill of a text. Thank you so much.
Thank you very much, Asia. And reporters, I just put into the chat this morning Africa Times letter of African Union leaders to South African President Ramaphosa, calling on him to walk away from the poisonous text. What you're hearing now is US civil society groups in solidarity with our brother and sister groups in the global South who have led this fight for a waiver and who today are calling out this text and calling on the governments to walk away. It is now my honor to introduce Akshya Kumar. She is with Human Rights Watch, and at Human Rights Watch, she is the Director of Crisis Advocacy. Akshya.
Thank you so much, Lori. It's been my honor to speak alongside this panel of really powerful human rights advocates, public health specialists, and community organizers, as well as trade experts like yourself. And it just bears repeating over and over again. The pandemic and its devastating and cascading human rights impacts are not over. Governments can't simply turn the page on this. They need to find a solution that's equitable and durable. This deal is not that. At Human Rights Watch, we share the deep concerns recently articulated by the United Nations Committee on the Elimination of Racial Discrimination, which pointed to a pattern of unequal distribution of COVID-19 vaccines and health technologies within and between countries that replicates what they said were slavery and colonial era racial hierarchies and further deepened structural inequities. In Geneva, as the Ministerial Conference opens on Sunday, it's been heartbreaking to learn of the green room tactics that are being used to strong arm the global South into accepting a deal that frankly wouldn't make anything better. Given their history, governments like the United States, but also UK, Switzerland, and members of the European Union actually have a special human rights responsibility to mitigate global inequities that further entrench the harmful legacy of these racial hierarchies. Instead, they're doing the opposite. At Human Rights Watch, we've consistently urged governments to make decisions at the WTO that are aligned with their international human rights obligations. The UN's Committee on Economic, Social, and Cultural Rights agrees. And as early as April 2020 said, pandemics are a crucial example of the need for scientific international cooperation to face transnational threats. They said sharing the best scientific knowledge and its applications, especially in the medical field, is going to be crucial to mitigate the impact of the disease and to expedite effective treatments and vaccines. This deal doesn't meet that standard. In conclusion, we believe that governments have a duty to prevent unreasonably high costs and barriers to access to essential medicines, treatments, tests, and vaccines. And unfortunately, as Asia said, what's being offered at the WTO is a poison pill. So in our estimation, it would be better for them to walk away rather than accept a deal that is simply too little, too late. Thank you.
Akshya, thank you very much. Before we go to our last speaker, I'd just like to invite reporters, please, to submit questions either by the question and answer chat feature. You can put them in writing, or you can raise your hand. And I think Arthur will be able to see you because I cannot, and he can call on you. It is now my honor to introduce Robert Weissman, the president of Public Citizen, and who is an expert on the access to medicines issues from decades of work, certainly during, but even prior to his being president of Public Citizen. Rob.
Thanks, Lori. Thanks you all for joining and for the panelists for your passion and insight and eloquence. You know, I think we're at a point now where we can look at the pandemic and see into the future and imagine what historians are going to think looking back on this pandemic. And I think the judgment is going to be excruciatingly harsh. It's going to be harsh because we failed to do what we knew should have been done. It's going to be extra harsh because, building what Asia said, we had experience with a similar kind of public health disaster decades before. We actually did better then than we're doing now, but we didn't do well. We should have learned from that. Instead, we seem to have learned how to do worse. But we should be careful in talking about we, because who's the we who's responsible? Well, I think when historians look back on this period, there's going to be a lot of harsh judgments for the rich countries, certainly for big pharma. But it may well be that the harshest judgment of all is reserved for the World Trade Organization, which had to do the least to be impactful. All it had to do was recognize for a once in 100-year pandemic, killing millions of people, which was obviously going to happen from the outset. It was not able to maneuver to waive its rules to protect big pharma monopolies. That was all that was being asked. It wasn't give money. It wasn't actually ensure the technology transfer. It wasn't go in the field and save lives. It was waive rules that were written by big pharma to protect their monopolies in the situation of a once in 100-year pandemic. And the institution has failed. And it's failing today, and it's going to fail again this weekend. I'm confident that we're not going to get the negative, counterproductive, so-called compromise waiver that's being discussed. It's not really even a waiver. I echo the calls for countries to walk away from it. I implore my government, the United States government, to step forward and try to salvage a positive waiver at this moment, but that doesn't seem likely right now. So assuming that does not happen, it does not mean the US government should be let off the hook. The US government should immediately say it will not pressure countries calling on the World Trade Organization rules or other bilateral trade agreements. It will not pressure them not to take steps to access vaccines and especially testing and treatment technologies. The US government should affirmatively assist with the transfer of the technologies that it controls and that US-based companies control, so that countries, especially poor countries, are able to access treatment technologies, testing, as well as the capacity to manufacture vaccines. You know, Paul said that the institution, the World Trade Organization, should be a vehicle by which we regulate the power of multinational corporations. But instead, it has proved through its existence and right now that it is an institution for corporations to regulate us. An institution for corporations to regulate us, to control the knowledge that we, the people of the world, collectively generated, to the technologies that we collectively developed, and to ration them for high price and to deny them to people in poor countries. Well, that's a condition that historians will judge very harshly and that we should not allow to persist one day longer. Thanks, Lori.
Thank you very much, Rob. Again, folks, reporters, to ask a question, please type one in the Q&A function or raise your hand. And I have one question in from the Wall Street Journal, which is, how would walking away from this text be a better outcome than this text? And I open the floor. I have thoughts on that, but I open the floor to everyone else first.
I can start. A reasonable measure of any text is if it leaves countries better off than worse off. And our understanding of this heavily bracketed text at this point is that it fails even that extremely conservative text. As of just hours ago, there have been reports of the UK and Switzerland actually proposing interventions that would increase beyond the floor of the TRIPS agreement, which is already heavily skewed in favor of the interests of the pharmaceutical industry, so that this proposal would increase the obligations in a time of pandemic devastation that all member states would be forced to uphold. So it's an Alice in Wonderland proposition where the UK is seeing an opportunity to carry water for big pharma, not prioritize the interests of people who are facing devastating lack of security. So what's appreciably, obviously better about walking away is that countries would not be bound by the TRIPS plus, so the excessive expectations of high-income countries that are being put on the table in a mad flurry of ambition in favor of pharmaceutical industry monopolies. That's what's being used here. This is a negotiating table that's being used almost as leverage by wealthy countries rather than the opposite. So that's one. I think the other is that even if some of these TRIPS plus, these noxious provisions are taken away, there is nothing that's put on the table here that improves the position of member states beyond the public health flexibilities that are already enshrined, such as they are in the WTO's rules. So what's better is a precedent that is harmful is not being set for future pandemics, which, by the way, are right in our backyards. Look at monkeypox, look at resurgence, and look at additional variants being created of COVID. These are not some far off concerns. They are here and now. So those are just two of many examples of why it's obviously better for countries to walk away from this poison pill text.
Thank you very much. And Saeed, just very specifically, the TRIPS plus elements that are in this text include language that is not currently not current restrictions on the flexibilities of countries, limited though they are under the TRIPS agreement, given that this isn't a waiver at all. This is about compulsory licensing, which is already allowed. And all the things that are allegedly clarified in this text are already allowed. There's one tiny little waiver, Article 31F. It's a waiver of some of the complicated procedures of exporting compulsory licensed medicines. And in this case, just vaccines. And it may be the most cynical thing I have ever seen at the WTO, the center of cynicism, because it is about the right to export without giving countries any ability to make more. So they have something to export. So on paper, it is a kind of a waiver that you can never use because you can never make more to export more. So what is TRIPS plus? One, there's what's called anti-diversion language that is vile, that says if you have gotten, if just out of a miracle, a unicorn occurs and you get more meds, which would not happen under this, and you have it sent to your country under compulsory licensing, you can't re-export to another country that needs it more, and if you don't need it. There are additional rules that have to do with the notices that you have to give when you are going to do an export versus the freedom to do it now. There are additional limits on what countries can have the benefits of this, where in the past, any waiver and any decision like the TRIPS agreement, the Doha Declaration to the TRIPS agreement covers all countries. And then finally, the clarifications that are supposed to be like the one upside, all the things you already can do, but now it's written down, those are explicitly limited to COVID and vaccines, which suggests that with respect to the existing flexibilities for COVID, the existing things that countries ostensibly can do don't apply. And to put this in harsh perspective, why the compulsory licensing approach isn't working. Right now, the Dominican Republic is trying to do a compulsory license for Paxlovid. So Pfizer has limited access to Paxlovid, known life-saving treatment. Half the world is not in the license, simply cannot get it. You will die if you are an unvaccinated person, high level of that in the developing world, you can't get Paxlovid. Dominican Republic's trying to get a compulsory license. Pfizer is in there, and that's allowed under the WTO, small molecule drug, so you don't need the tech transfer probably. Pfizer is in there tooth and nail, trying to make sure that that cannot happen. That's why we needed a waiver. Anyone else want to speak to why nothing is better than this?
Can I add
Akshya.
just on 2 points? And you already raised these, Lori, but from a human rights perspective, we're deeply concerned about those provisions that hinder re-exportation because it could adversely impact the pooled procurement efforts that we've seen and the sharing of unused doses. And we know that many developing countries have ended up sharing unused doses with other developing countries. That has been the kind of South-South cooperation that has helped access and expand access, and we wouldn't want to handcuff them. And in particular, it could also be costly and invasive for governments to enforce anti-diversion measures. And we have experience with this. A few years ago, health experts, including the United Nations Special Rapporteur on Health, warned that anti-diversion measures actually pose a barrier to providing access to an important hepatitis C treatment. So we don't need to repeat the mistakes of the past here. If governments are being forced to enforce anti-diversion measures, they would have to verify where vaccines are being administered. That's more of a burden in a moment where everyone is stretched too thin.
Thank you, Akshya. And I apologize, I did not see your hand or Paul's. Paul, please.
Thanks, Laurie. No, these have been great comments. A couple of very brief additions. First, Saeed, I would encourage you to take a look at what Indian and South African civil society are saying about this agreement, because in our view, it's not the case that these are, and to go back to Robert's earlier point, the decision-making on this should not rest either with pharmaceutical companies or undemocratic governments. It should rest with people. That's why we joined the People's Vaccine Alliance. This is fundamentally not about doing just enough to make some progress, but making sure that everybody on the planet has a basic right to survive this pandemic. That's what we're asking for governments to come together and put the conditions in place for. And obviously, at the risk of repeating what others have said, but this is all about political will. And if we use up precious political will by giving the veneer of an agreement that is actually a poison pill, we will rob ourselves of the oxygen to put together the kind of political will that will actually deliver safety and security for people all around the world on this.
Thank you very much. We have two more questions. One is also from the Wall Street Journal. India and South Africa decided that if India and South Africa have decided that the text is better than no text, what are they not seeing? What are they getting wrong in your view? No, actually, the if is not, it's blurry. India and South Africa have decided. So let me just start by clarifying. India and South Africa haven't supported this text. That's the scandal of this whole process. There was a text that was sponsored by India and South Africa with 65 sponsors that has never gotten negotiation. The WTO Director General called together India, South Africa, the US, and Europe to try and get a compromise consensus text. That failed. They had a lowest common denominator emerge of the US refusal to have anything but vaccines covered, no treatments, no tests. Cynical, given the US strategy now is test and treat. And the EU refusal to have any waivers. That text was only supported by the EU, yet that's the text that's been subject to negotiations. So why, I'm going to add the if now, if South Africa and India were to decide, I guess, wouldn't block the text, what are they getting wrong? Anyone?
Sorry, Laurie, I won't say it again, but I had read the two questions from Saeed and I folded my responses into both. So that was why I made the request that the journalists actually have a look at what Indian and South African civil society are doing. No further comment.
Okay, Rob.
Well, I guess the way to begin is by reiterating what Laurie said. So this is a hypothetical, and not what we understand to reflect what's actually happening. There's two parts to it. I mean, one, if they were to make a misjudgment and agree, I think it would be wrong for the substantive reasons that folks have just laid out. And there's a lot of writing on this from the Global South and from us too, that sort of gets into the nitty gritty of the TRIPS history and the text of the TRIPS in great detail. But the second thing I think, which sort of builds on a point that Paul made, would be the real reason. The real reason they would do it is not because they believe. The real reason they would do it is because they were bullied into it. And in fact, that's the entire history of the TRIPS agreement and everything around the intellectual property fights of the last 25, 35 years. Poor countries aren't stupid. They understand exactly what's at stake. They understand exactly what technology they need. They understand exactly how they should be accessing it. They understand exactly what the tools are, both technologically and legally, to access those technologies. But they also understand and live in the world as it is, and they understand power politics, and they often concede to things that they don't believe are right. And I can't say that, but we all know it to be true. You know it to be true. We all know it to be true. They know it to be true, and the U.S. government negotiators know it to be true. And above all, Big Pharma knows it to be true. So if there's a bad compromise, it will be because rich countries acting on behalf of Big Pharma bullied the developing world, even powerful countries like South Africa and India, into accepting it. That said, I don't think they have, and I don't think they will.
Thank you very much, Rob. Appreciate that. And I would only add what several of our partners from Africa, Fatima Hassan from Cape Town, from the Health Action Initiative, and the head of the Liberian Nurses Association said in a news conference last week with Winnie, the head of UNAIDS, and Joe Stiglitz, which was basically that the governments of the African countries have been put in a situation with other parts of the WTO negotiation being held over their heads in this sort of bullying, pressurizing situation Rob was describing generally, and very specifically with respect to India. The pressure is, oh, you want something on food stock holding? Well, that's not going to go well unless you shut up in the TRIPS discussions. And similarly, with a variety of the African countries for whom small-scale fishing is incredibly important, the fisheries negotiations are being used as a sort of, you better be careful because. But I want to underscore something that has been mentioned but not specified. The procedures and processes of the last 2 weeks have demonstrated the worst of the WTO bullying. And I want to be specific because some of this has been documented by Third World Network and publications, by the Geneva Health Notes. But at this point, literally, WTO Secretariat staff is keeping countries out of the green room negotiations, which, when this rump text came up, started with 30 countries, invitation only. It's down to a place where countries like Indonesia and Pakistan, who've been leading on trying to get the text expanded to treatments and tests, who've been leading the effort to get the word necessary taken out, which is another of the TRIPS plus additions, they're being locked out now. It's down to 6 developing countries allowed in the room. And so it's a situation basically to try and steamroller a particular outcome. The green room scenario and that level of bullying is a system to basically have the priority be the WTO's institutional public relations and not the saving of lives. And what all the speakers here are standing up for, which is in solidarity with what civil society in South Africa, in India, in numerous Latin American countries, in other Asian countries, and other African countries, we're following their lead, as we have been in this whole campaign, because it's the lives of people in those countries scandalously exposed with less than 20% vaccination rates 2 years into this pandemic, when, as Rob said, we have the tools to save lives. These are needless deaths. This is not necessary. So with that, I'm going to call for any other additional questions. I will only say that the video of this and a transcript will be posted at the Trade Justice Education Fund's website. Last call for questions, and I'm looking to see if that text is about this. No, it is not. I will then thank everybody, ask if anybody has a final statement they'd like to make of our much appreciated speakers. Last call, as they say, and thank you all very, very much for participating, reporters for joining. At stake is an enormous amount, and we urge you to cover it. Thank you very much.